Here is a number that'll shock you. Studies show that nearly half of patients who start GLP-1 medications stop taking them within the first year. Not because the drug is not working, because they were never prepared for what it does inside their body. Last month, a patient of mine came in for her 4-month follow-up. 52 years old, type 2 diabetic. She had lost 34 pounds on Mounjaro, but she was not happy. She said, "Dr. Kethu, I feel nauseous every morning. I can barely eat 3 bites before I feel full and stuffed. My stomach makes sounds I've never heard before, and I have not gone to the bathroom in 4 days." I looked at her and said, "Everything you just described, that's exactly what Mounjaro is doing to your gut. It is supposed to do that." She looked very surprised. And that's the problem. Millions of people are taking Tirzepatide right now, and nobody has explained what this drug actually does inside your own gastrointestinal tract. Not their prescribing doctor, not their pharmacist, not the internet. I'm going to do that today, because once you understand what Mounjaro does to your gut, the weight loss makes sense. The side effects make sense. The food changes make sense. All of it will make sense. Stay with me. I'm Dr. Kethu. I'm a double board certified gastroenterologist and hepatologist. I'm a former professor at Brown University Medical School. I've been doing endoscopies, colonoscopies, and treating GI disease for over 20 years. Lately, my practice is full of patients who are on Mounjaro or one of the other GLP-1 medications. I see what this drug does to the gut up close every single week. Today, I'm walking you through it, mechanism by mechanism, in plain English. Let me start with one thing most people get wrong about Mounjaro. It is not the same as Ozempic. Both are weekly injections, both cause weight loss, but they hit completely different targets. Ozempic, generic name semaglutide, works on one gut hormone receptor, GLP-1, whereas Mounjaro, generic name Tirzepatide, works on 2 receptors simultaneously, GLP-1 and GIP, 2 gut hormones at once. This is why the clinical results are different. The SURMOUNT-1 trial, which is a large clinical trial, showed Tirzepatide patients losing up to 21% of their body weight, numbers we have had never seen before with any medications, because it's hitting 2 targets at the same time. But here is what I want you to understand as a gastroenterologist. GLP-1 and GIP are not random drug targets. They're hormones produced inside your own intestinal lining right now every time you eat. They're part of your gut's communication system with the rest of your body. When you take Mounjaro, you're not just suppressing appetite, you're fundamentally changing how your entire GI system functions, from your stomach to your intestine to your colon and to your brain. There are 4 mechanisms driving all of it. Let me walk you through one by one. First mechanism, and the one that explains the most common side effects, is dramatically slowed gastric emptying. Tirzepatide slows how fast your stomach empties food into your small intestine. Here is the analogy I use with my own patients. Normally, your stomach is like a conveyor belt where things keep moving. Fast turnaround, efficient. On Mounjaro, that conveyor belt slows way down. Your stomach holds food much longer before it passes through into the small bowel. 3 things happen from this single change. First one is you feel full and fast. 3 bites of food and your stomach is already signaling satiety. Your brain is telling you your stomach is full. Smaller portions naturally. This is a core weight loss mechanism. Second is your blood sugar stays more stable after meals. Because food drips slowly into your small intestine instead of flooding in, glucose enters your bloodstream gradually, no spike. This is why Tirzepatide is so powerful for type 2 diabetes, independent of weight loss. Next is nausea. If your stomach is always backed up and processing slowly, nausea is the result. bloating and reflux, the feeling of a brick sitting in your stomach after even a small meal. This is not random. This is your stomach doing exactly what the medication tells it to do. This is why eating strategy on Mounjaro matters enormously. Large meals, fatty, fried foods, high-fat portions, these dramatically worsen delayed gastric emptying. When you eat small meals, high protein and low fat, your stomach handles things much more comfortably. And for a small percentage of patients, especially anyone who already had borderline gastroparesis before starting, for example, if they had diabetes causing slowed gastric emptying, Tirzepatide can push them into a clinical problem. That is something I screen for in my practice before prescribing. The second mechanism is reduced gut motility, and this one reaches further than most people realize. The slowdown doesn't stop at your stomach. Mounjaro reduces gut motility throughout your entire GI tract. Gut motility is that wave-like muscle movement that pushes food from your stomach through your small intestine and then to your colon. Tirzepatide slows that wave down everywhere. In your small intestine, carbohydrates and sugars absorb more slowly. Blood sugar stays flat. That's a benefit. In your colon, slower movement means food waste spends more time inside your intestines before elimination. The result is constipation. One of the most common reasons people quietly stop taking Mounjaro without telling their doctor. If you're on Tirzepatide and you have not gone in 3 or 4 days, that's your gut motility slowing down. The solution is not to stop the medication. It's to address the cause. More fiber, more water, and more movement. And the last one matters more than most people think. A 10-minute walk after meals can restart your colon's wave motion in ways that no laxative can replicate long term. Sometimes a gentle laxative is a useful short-term bridge though. But movement is the medicine. Now there is another motility effect I need to tell you about. One that most prescribing doctors never mention, and one that can land you in the emergency room if you're not watching for it. The gallbladder. GLP-1 hormones naturally inhibit gallbladder contractions, which reduces bile emptying into your small intestine. Mounjaro enhances that inhibition. Your gallbladder doesn't empty as well. Bile stagnates. Combine that with rapid weight loss, which shifts your cholesterol concentration in bile, and you are at a real risk for gallstone formation. I had 3 patients this year alone developing symptomatic gallstones while on Mounjaro. None of them were warned. If you are on this drug and you develop right-sided abdominal pain, pain after fatty meals, or pain radiating to your right shoulder, see a gastroenterologist. Do not ignore it. The third mechanism is where this gets genuinely fascinating. Because Tirzepatide doesn't just work in your gut, it works on the highway between your gut and your brain. Most people assume Mounjaro works by shrinking your stomach or slowing your digestion. That's only part of it. But the most powerful mechanism may be what it does to your brain. Your gut and your brain are in constant conversation or communication. The messenger line is called the vagus nerve, a massive nerve running directly from your gut up to the brain. GLP-1 is produced in your intestinal lining after meals. It travels the vagus nerve directly to your hypothalamus, your brain's hunger and fullness control center, and tells it, we have enough, stop eating. When Mounjaro activates GLP-1 receptors in your gut, that signals fire even more powerfully. Direct appetite suppression coming from your own gut biology. But here is what the newer research shows and what most prescribing doctors haven't caught up with yet. GLP-1 and GIP receptors exist in the brain itself, not just in the gut. Tirzepatide appears to activate reward centers in the brain, and the pull that ultra-processed, high-fat, high-sugar foods have on you simply goes quiet. My patients described it the same way consistently. Dr. Kethu, I used to think about food constantly, pizza, chips, and ice cream. Now I just don't. This is not just appetite suppression. This is a behavioral rewiring driven by gut hormones acting directly on your brain circuits. A 2025 study in Nature Medicine confirmed that Tirzepatide activates hypothalamic energy balance circuits in a way that goes beyond satiety. It appears to reset the neurological drive to overeat. And now the fourth mechanism is the one that excites me most as a gastroenterologist, and it is the most underreported effect of this entire drug class: the gut microbiome. Early research, primarily in animal studies, suggests that GLP-1 receptor agonists may shift the gut microbiome toward a healthier, more anti-inflammatory profile. Specifically in mouse models, levels of a bacteria called Akkermansia, strongly associated with gut barrier integrity and metabolic health, appear to increase with the Tirzepatide treatment. This is the same bacteria researchers are now investigating as a direct therapeutic target for obesity and type 2 diabetes. Preliminary data suggests that microbiome changes may contribute to metabolic improvement beyond what the weight loss alone explains. The drug may be reshaping your gut ecosystem in ways that multiply its own benefits. Human studies are ongoing to confirm these findings, though. Here is my clinical bottom line. What you eat at Mounjaro is not optional strategy. It is active treatment. Dietary fiber, fermented foods, whole plants. These give your microbiome the tools to work with the medication, not against it. Mounjaro opens a window. Your diet determines what walks through it. And that brings me to something I want to be completely direct with you about. Because your prescribing doctor may not have covered it, not everyone should be on this medication. If you have a personal or family history of medullary thyroid cancer or MEN2 syndrome, Tirzepatide carries an FDA black box warning, and that is a hard stop before you even consider starting. If you already have gastroparesis, for example, if you already have long-standing diabetes causing gastroparesis, Mounjaro can push that into a medical emergency. If you have a history of pancreatitis, while current data do not show a statistically significant increased risk, there have been rare reports of acute pancreatitis with this drug class, and you should have a specialist conversation before you start. If you have active gallbladder disease, for example, rapid weight loss combined with reduced gallbladder motility is a gallstone recipe you do not want to test. And if you have any unexplained GI symptoms right now, nausea, bloating, abdominal pain, changes in bowel habits, get a GI evaluation first before adding a drug that changes your gut function on top of a gut you don't yet understand. I'm not telling you this to scare you away from the medication. I'm telling you because there is a difference between being a patient and being an informed patient. Here is what I want you to walk away with. Mounjaro, Tirzepatide, is not just a weight loss injection. It is a drug that fundamentally changes how your entire GI system operates. It slows gastric emptying, so you eat less. Your blood sugar stays stable. It reduces the gut motility, which helps glucose control but also causes constipation and gallstone risk. It activates the gut-brain axis, rewiring appetite and food cravings at the neurological level. And early evidence suggests it may reshape your gut microbiome, potentially compounding its metabolic benefits over time. Understanding this doesn't just satisfy your curiosity, it makes you a smarter patient. It tells you exactly why you eat smaller portions, why fiber matters, why your cravings change, why certain side effects happen, and when they mean you need to call your doctor. If this video helped you understand something your doctor didn't explain, share it with someone who is on Mounjaro or thinking about starting. And next, watch my video on butyrate and the gut microbiome. Butyrate production, gut barrier health, and microbiome diversity all directly influence how well Tirzepatide works for you. The connection is deep. I will put that link right here. I'm Dr. Kethu. Your gut is running the show. Let's make sure it runs well. Thank you.